1. Introduction. A stroke is a serious medical condition that occurs when blood flow to a part of the brain is interrupted, either due to a blocked artery, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. Without oxygen and nutrients from the blood, brain cells begin to die within minutes, leading to potential long-term disability or even death. Strokes can happen suddenly and without warning, making them a leading cause of disability worldwide. Early recognition of stroke symptoms and immediate medical action are crucial in minimizing brain damage and improving recovery outcomes. The faster a stroke is diagnosed and treated, the higher the chances of survival and reduced complications. Common signs include sudden numbness or weakness in the face, arm, or leg, confusion, trouble speaking, severe headache, and difficulty walking. Remembering the acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, can help in identifying a stroke quickly. Delaying treatment can have devastating consequences, including permanent paralysis, speech impairments, memory loss, and even death. Many stroke survivors face long-term rehabilitation to regain lost functions, while others may never fully recover. Public awareness about stroke symptoms and the urgency of seeking medical help can save lives and prevent severe disabilities. Acting fast is not just important, it can make the difference between life and death. 2. Understanding stroke. A stroke is a life-threatening medical emergency that occurs when blood supply to part of the brain is disrupted, leading to brain cell damage or death. There are two main types of stroke, ischemic and hemorrhagic. An ischemic stroke, the most common type, happens when a blood clot blocks an artery supplying blood to the brain, often due to atherosclerosis, plaque buildup in arteries. A hemorrhagic stroke, though less frequent, is more severe and occurs when a weakened blood vessel ruptures, causing bleeding in or around the brain. Both types can result in permanent brain damage, disability, or death if not treated immediately. Several factors increase the risk of stroke, with high blood pressure, hypertension, being the leading cause. Uncontrolled hypertension damages blood vessels over time, making them more prone to blockages or ruptures. Diabetes also raises stroke risk by contributing to artery damage and promoting clot formation. Other major risk factors include smoking, high cholesterol, obesity, physical inactivity, and excessive alcohol consumption. Additionally, conditions like atrial fibrillation, irregular heartbeat, can lead to blood clots that travel to the brain, triggering a stroke. Age, family history, and genetics also play a role, with older adults and those with a family history of stroke being at higher risk. Understanding these causes and risk factors is essential for prevention. Lifestyle changes, such as maintaining a healthy diet, exercising regularly, quitting smoking, and managing chronic conditions, can significantly reduce the likelihood of a stroke. Early detection and control of risk factors are key to preventing this devastating condition. 3. Common early warning signs. One of the most recognizable signs of a stroke is sudden numbness or weakness, particularly on one side of the body. This often affects the face, arm, or leg, causing drooping on one side of the mouth or difficulty lifting an arm. If someone suddenly struggles to smile evenly or raise both arms, it could signal a stroke. Another critical warning sign is sudden confusion or trouble speaking, including slurred speech, difficulty forming words, or an inability to understand others. The person may seem disoriented or unable to respond coherently, even in simple conversations. Vision problems can also indicate a stroke, such as sudden trouble seeing in one or both eyes. This may appear as blurred vision, double vision, or even complete vision loss in one eye, often without pain. Additionally, sudden trouble walking, dizziness, or loss of balance and coordination may occur, making the person stumble, veer to one side, or struggle to stand upright. Unlike normal dizziness, this imbalance comes on abruptly and may be accompanied by nausea or vomiting. One of the most alarming signs is a sudden, severe headache with no known cause, often described as the worst headache of one's life. This could indicate a hemorrhagic stroke due to bleeding in the brain. Unlike a typical headache, this pain strikes rapidly and intensely, sometimes leading to vomiting or unconsciousness. Recognizing these warning signs and acting immediately by calling emergency services can save lives and prevent long-term disability. Every minute counts when responding to a stroke. 4. The FAST acronym. Recognizing a stroke quickly can mean the difference between life and death, and the FAST acronym is a simple yet powerful tool to help identify stroke symptoms in an emergency. The first letter, F, face drooping, refers to sudden facial weakness or numbness, often causing one side of the face to sag. Ask the person to smile. If one side of their mouth droops or doesn't move, it could be a stroke. The next indicator, A, arm weakness, involves sudden weakness or numbness in one arm. If the person cannot raise both arms evenly or one arm drifts downward, this is a major warning sign. The third component, S, speech difficulty, checks for sudden trouble speaking or understanding speech. Slurred words, jumbled sentences, or an inability to repeat a simple phrase clearly indicate a possible stroke. Finally, T, time to call emergency services, emphasizes that every second counts. If any of these symptoms appear, immediate medical attention is crucial. Even if symptoms seem to improve or disappear, calling emergency services right away is essential, as early treatment can prevent permanent brain damage. The FAST method is designed to be easy for anyone to remember and use, whether at home, work, or in public. Studies show that people who receive prompt stroke treatment have much better recovery outcomes. By spreading awareness of FAST, we can empower more individuals to act quickly, potentially saving lives and reducing long-term disability. Remember, face, arm, speech, time, know the signs, and act fast. 5. Less common symptoms. While strokes are often associated with classic symptoms like facial drooping or slurred speech, some less typical signs may also occur, particularly in women and elderly patients. Sudden, unexplained hiccups, persistent nausea, or chest pain can sometimes signal a stroke, especially in women, who may experience more subtle or atypical symptoms. These signs are frequently overlooked or mistaken for other conditions, delaying critical medical intervention. In rare cases, a stroke may trigger seizure-like activity or sudden fainting, which can be mistaken for neurological or cardiac events. Unlike typical seizures, these episodes occur abruptly without a prior history of epilepsy and may be accompanied by other stroke symptoms. Similarly, elderly patients may present with unusual fatigue, sudden confusion, or disorientation without obvious weakness or speech problems. These vague symptoms are often dismissed as normal aging or dementia, but they can indicate a silent stroke affecting blood flow to critical brain regions. Recognizing these less common symptoms is crucial, as they may be the only warning signs in certain individuals. Women, older adults, and those with pre-existing conditions should be especially vigilant. When in doubt, seeking immediate medical evaluation, even for seemingly minor or unusual symptoms, can prevent devastating consequences. Stroke doesn't always announce itself dramatically, so awareness of these subtler signs could save a life. 6. What to do immediately. When stroke symptoms appear, time is brain, every minute counts. The first and most critical step is to call emergency services immediately, even if symptoms seem mild or fluctuate. Never wait to see if symptoms improve on their own, as early medical intervention can dramatically improve outcomes. While waiting for help, note the exact time symptoms began, as this information helps doctors determine the best treatment options. Certain stroke treatments, like clot-busting drugs, are only effective within a specific time window. Avoid giving the person food, water, or medication, as swallowing difficulties are common during a stroke and could lead to choking. Some medications, like aspirin, might be harmful if the stroke is hemorrhagic rather than ischemic. Unless instructed by emergency responders, it's safest to withhold anything by mouth. Keep the person calm and comfortable, preferably lying on their side if they're drowsy or vomiting, to prevent choking. Loosen tight clothing and ensure they're in a safe position to avoid falls or injury. Stay with the person until medical help arrives, monitoring their breathing and consciousness. Reassure them that help is on the way, as anxiety can worsen their condition. Quick action and proper first response can mean the difference between recovery and permanent disability, so act fast, stay calm, and let professionals take over as soon as possible. 7. What not to do. When someone shows signs of a stroke, avoid driving them to the hospital yourself. Emergency medical services, EMS, are trained to provide critical care en route and can alert the hospital in advance, ensuring faster treatment upon arrival. Paramedics can also stabilize the patient and begin life-saving interventions that you cannot provide in a private vehicle. Every second counts, and professional transport significantly improves survival chances. Never assume the symptoms will go away on their own, even if they seem to improve temporarily. Some strokes have fluctuating symptoms, or a person may experience a transient ischemic attack, TIA, often called a mini-stroke. While TIAs may resolve quickly, they are major warning signs of an impending full stroke and require immediate medical evaluation. Ignoring them could lead to catastrophic consequences. Do not delay calling for help, even if the symptoms appear mild or brief. What seems like a minor issue, such as slight slurred speech or temporary numbness, could indicate a serious underlying condition. The faster a stroke is treated, the better the chances of recovery. Waiting to see if symptoms worsen risks permanent brain damage or death. Remember, when in doubt, act immediately. It's always better to be safe than sorry. 8. Importance of fast medical attention. The speed of medical response to a stroke directly determines the patient's chances of survival and recovery. Strokes cause brain cells to die at a rapid rate. Up to 1.9 million neurons are lost every minute without treatment. This is why immediate action is crucial. The most effective treatments, such as clot-busting drugs, thrombolytics, must be administered within 3 to 4.5 hours of symptom onset for ischemic strokes. Beyond this window, the risk of complications increases, and treatment options become limited. One of the most critical interventions for ischemic stroke is tissue plasminogen activator, TPA, a clot-dissolving medication that can restore blood flow to the brain. When given promptly, TPA significantly improves recovery rates, reducing long-term disability. In some cases, mechanical thrombectomy, a procedure to physically remove the clot, can be performed up to 24 hours after symptom onset in eligible patients, but earlier treatment yields better results. Fast medical attention doesn't just save lives, it preserves brain function. The sooner blood flow is restored, the less permanent damage occurs. Patients who receive timely treatment have higher chances of regaining speech, movement, and independence. Delays, on the other hand, can lead to severe paralysis, cognitive decline, or even death. Recognizing stroke symptoms and calling emergency services immediately is the single most important step in ensuring the best possible outcome. Time lost is brain lost. Acting fast can mean the difference between recovery and a lifetime of disability. 9. Stroke prevention tips. One of the most effective ways to prevent stroke is by managing blood pressure and cholesterol, as these are leading risk factors. High blood pressure damages blood vessels over time, while elevated cholesterol contributes to plaque buildup in arteries. Regular monitoring, lifestyle changes, and prescribed medications can help keep these levels under control. A heart-healthy diet low in sodium, saturated fats, and processed foods plays a crucial role in maintaining optimal cardiovascular health. Staying active and eating a balanced diet significantly reduces stroke risk. Engaging in at least 30 minutes of moderate exercise most days improves circulation, lowers blood pressure, and helps maintain a healthy weight. A diet rich in fruits, vegetables, whole grains, and lean proteins, such as the Mediterranean or DASH diet, supports brain and heart health. Reducing sugar intake and avoiding excessive red meat consumption also contribute to better vascular function. Avoiding smoking and limiting alcohol are essential for stroke prevention. Smoking accelerates artery damage and increases clot formation, while excessive alcohol consumption raises blood pressure and contributes to irregular heart rhythms. Quitting smoking and moderating alcohol intake, no more than 1 drink per day for women and 2 for men, can dramatically lower stroke risk. Finally, regular medical checkups and medication adherence are vital, especially for those with chronic conditions like diabetes or atrial fibrillation. Routine screenings help detect risk factors early, and taking prescribed medications as directed, such as blood thinners or antihypertensives, prevents complications. Stroke prevention is a lifelong commitment, but small, consistent changes can make a profound difference in maintaining brain health and overall well-being. 10. Conclusion. Recognizing the key warning signs of stroke, sudden face drooping, arm weakness, speech difficulties, severe headache, or balance problems, can save lives. The FAST acronym provides an easy way to remember these critical symptoms. When any of these signs appear, immediate action is essential. Call emergency services without delay, note the time of symptom onset, and keep the patient calm while waiting for medical help. Remember, never ignore symptoms, even if they seem minor or temporary, as early intervention greatly improves recovery chances. Spreading awareness about stroke symptoms and response is just as important as recognizing them yourself. Educate family, friends, and colleagues about the FAST method and emphasize the urgency of quick action. Many stroke-related disabilities and deaths can be prevented simply through public knowledge and timely response. Share information through conversations, social media, or community health programs to make a broader impact. Ultimately, when it comes to stroke, every second counts. Brain cells die rapidly during a stroke, and delays in treatment can lead to permanent damage or fatal consequences. Whether you're at risk or not, being informed and prepared ensures you can help yourself or others when it matters most. Stay vigilant, act fast, and remember, quick response doesn't just save lives, it preserves quality of life.